COVID-19 as pandemic. An informative speech.
Good day, ladies and gentlemen. Thank you for being here today. And by the way, I'm Maivell Nacion from BSED Filipino 2A. I am here to talk to you about the current situation, not just in our country but in the whole world. It is about the COVID-19 as pandemic. As we can see, cope with COVID-19 pandemic continues to take a heavy toll on families, communities, and nations over. But it is also giving rise to incredible act, the generosity, solidarity, and cooperation. We have said consistently that we're all on this together, and we can only succeed together. We need an auto-society approach with everyone playing their part. Thousands more are fighting for their lives and not with us. In the days and weeks ahead, we expect to see the decreasing number of cases, deaths, and decreasing number of affected countries. COVID-19 can be characterized as a pandemic. But do we all know what pandemic is? Pandemic is not a word to use lightly, neighbor courtesy. It is the word that if we see your skin cause unreasonable fear or unjustified acceptance of the fight discomfort. And then, pandemic is an outbreak of a disease that spreads worldwide and it affects high proportion of the population. We have never seen before a pandemic sparked by a coronavirus. This is the first time that pandemic caused a coronavirus. We have never seen before a pandemic that can be controlled at the same time. We have to do an aggressive action. We have brought the alarm bell now in here. Just by looking at the number of affected countries captures the stuffed elephant story. We cannot say this loudly enough, or clearly enough, or often enough. All cultures can still change the first of this pandemic. Several countries demonstrated, at least by risk and ease of breath, and control the challenge for many countries who are now dealing with large clusters of or community transmission. Some, whether they can do the same. It's whether they will. Some countries struggling with lack of capacity, some countries and struggling with lack of result, and some countries struggling with lack of resources. We are grateful to the measures being taken in our country to slow the virus and control the epidemic. We know that these measures are taking ahead its all advanced societies and economies. All the fastest right, a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights. This is not just a public health crisis. It is a crisis that needs every sector, so every sector, every individual must be involved in the fight. All of us must take as whole of government be around a comprehensive strategy to prevent infection, save lives, and minimize impacts. Let me summarize the 4 key areas. First, prepare and be ready. Second, detect, protect, and treat. Third, reduce transmission. And fourth, innovate and learn. I just want to remind all of us to activate and speed up our emergency response mechanisms. Communicate with other people about service and how they can protect themselves. This is everybody's business. Help our frontliners and let us look for each other because we need each other. There's been so much attention and language. Let me give you some other words that I'm not and much more and that are much more actionable. The prevention, preparedness, public health, and most of all, people. It is not only the government alone that we're going to fight this battle. it will be possible to end the misery if all of us, every one of us, will support, obey, and have a unity for our beloved Pearl of the Orient. And this is my informative speech about the COVID-19 as pandemic. And that could be all. Thank you.